Anna-leena Lohiniva from the Finnish Institute of Health and Welfare from Finland. And what's really nice is that THL has been very active as well as a partner in PHIRI. So we're very happy to see Anna-leena here. She is supporting COVID-19 response in Finland with the Finnish Institute for Health and Welfare by initiating and managing a COVID-19 related social listening system, conducting an operational research. So COVID-19 related stigma and discrimination and IPC practices. Rapid investigation to vaccine hesitancy as well. She's also a specialist in behavior change communication. So we're very much looking forward to what Anna-leena can bring to us. So go ahead, Anna-leena.
Thank you very much for inviting me here to talk. I'll be sharing you our social listening project, which we have been running since the early times of the pandemic. We started February 2020 to monitor the pandemic-related perceptions of the public. And this is a practical approach, as a kind of a tool that we have been using to benefit risk communication of DHL. Next. And so the public basically is communicating with DHL through many different channels. There are lots of different social media channels, but there are also different kind of information mailboxes where the public can get in touch with us. And of course, there is always part of the public that is contacting public health experts directly through their private email. So there is a lot of communication. And before we had a system in place, different experts, risk communication experts and public health experts were using this information on their own, making their own interpretations, and perhaps using that also in a communication individual basis. So what kind of changed then, once we started to take this integrated system, we were pulling in all this information of the public into one report and then disseminating it to everyone who is communicating in the house with the public. So definitely this change, first of all, unified much about the messaging, about the pandemic and related issues, and also it gave opportunity for more people in the house to benefit from such information. Next. In this slide, you can actually see a summary of the methodology. How did we do that? And as I mentioned, one of the key of importance for us was to do something practical and do something in real time. And do something in real time that is enhancing the understanding. So it was clear for us from the very beginning that we wanted to focus on qualitatively understanding the narratives and the perceptions of the public. And that all was meant to then feed into the communication content building. So really for the contents and messaging, that's where the benefits of this system were focused. And so starting to build the process, we had to think first which data sources we want to use. Obviously, we can't use everything. We have to make prioritization. A lot of our prioritization was related to issue of the practicality. In such a situation like a pandemic where everybody is extremely busy, one wants to have a system which is not really overloading colleagues too much. So we decided to pick Facebook, which is easily accessible for us through the Social Bakers platform. And we also picked info mailboxes where we as a risk communication team had also already access. So that was the prioritization part. And then the second, I think, even more crucial issue was really to think how to now use the qualitative tools to analyze. You know, always, of course, qualitative is very highly time consuming, and we wanted to do it something rapid. So it took some thinking how to make a system and analysis which is not too thin, but at the same time is not putting too much of our time for it. One of the issues that we focused on was creating or using frameworks, conceptual frameworks in the analysis, which definitely made the process faster. So we were coding and we were categorizing as in any rapid qualitative assessment. But after the categorization, we were not creating theories or further theories, but we drafted risk communication recommendations. So practical recommendations that were based on very simple principles of risk communication and behavioral insights, principles of behavioral insights. And once we had these recommendations in place, then we usually, next step was to share this with a smaller group of experts. So we were applying knowledge co-creation to verify and discuss the findings in a small group, get the consensus and get an understanding that we have a consensus about the findings and about the recommendations, so that the recommendations are acceptable and they are also feasible and practical. They can actually be implemented within the experts or with the experts of the DHL. And once this verification had taken place, then the findings were disseminated to everyone in the house who is communicating with the public through a short PowerPoint presentation. And in addition to this, we had also, every time a new report came out, short half-an-hour online meeting where we shared and discussed the findings further. And so the system that we have been doing has been approximately once a month, and we have been doing this really since the February 2020. Next. And why did we want to have this kind of system in the first place? Our idea was really to focus on the context specificity. Very often, you know, in a risk communication in the pandemic situation, the messaging is very generic, which is also understandable because a lot of people needs to be reached in a short time. But at the same time, in a risk communication, it's also important really to understand the context, because as we all know, the perceptions of the health and illness are very different among different people. The interpretation and understanding is very different.
Anna-leena, it seems you muted yourself. We just lost your voice. Anna-leena, we were hearing you perfect just earlier, but I think you maybe just by accident touched your spacebar, so we lost sound.
Okay.
Yes, you're back. Perfect.
Okay, sorry. So I'm not sure how much I managed to talk about it, but yes. So basically, we wanted to look at the context specificity of physical distance taking, greetings, hygiene. We were also looking at normative rules, how the public is perceiving these instructions of the authorities. Where are the trust factors, and where are the factors that are creating mistrust, and also looking into motivation, all the way for motivation for mask use, but also motivation of taking, for example, vaccines. Younger people definitely are motivating, have a different motivation towards the vaccines than older ones. And all that context we were really intending and planning and wanting to get out of this exercise. Next. And the second kind of a reason that we thought of also the importance of this was really that there is so much misunderstandings often between the health authorities and public. Health authorities prefer using very technical wording that we have also realized during the pandemic. And it is also possible that public is not understanding this concept and the science and evidence that is communicated in the right way. So again, this monitoring system allows us to see whether these concepts are understood and where the reactions are in order to be able to take an action. Next. I will give you just a couple of practical examples, one from the early times of this system and another one a bit earlier. Next. This is the analysis from the first springtime 2020, where the data showed us that people were very well aware of these new instructions of social distancing and mask using. But it was also clear that although they knew this messaging, they did not know how to handle them or what to do in practice with these things. They had questions like what to do if I go to a crowded shop, what to do if I go to an elevator, what do I do when I have to take my child to the childcare. So we thought of that there is a need for a provision of practical guidance, how to manage the transmission of coronavirus in everyday life. We took a personal risk assessment methodology and decided to disseminate this idea through some social media influencers. Next. So we had webinars with these social media influencers. We asked them to record all the risk factors they had in their everyday life from the morning to the evening. And once they set them up, we were asking them how to reduce these risks in their everyday life. So for example, if they felt like using elevator was a risk factor, they could perhaps take the stairs. Or if they thought of buying groceries in the afternoon was a big risk factor, they could perhaps consider using online shopping. So after this risk assessment exercise, we also encourage them to share the same exercise with their followers and do and spread the word of concretizing these actions. Next. My other example comes from this springtime, where the data showed that people were getting very tired, first of all, of using masks and having the social distancing and not being able to meet friends. And the data and the narrative showed, and people did not think that other people were any longer doing it. Like, I'm the only one who is using the mask, and my friends are already having parties. Why should I stay at home? So clearly, what was positive about this was that we could see that people had really well internalized the importance of the behavior of each individual, actually, but they really didn't feel that this was happening anymore. And so we really thought that there is a need to promote these behaviors as a normative behavior. And we came up with a small campaign where we'd be promoting positive examples through video clips. Next. So we had known figures in Finland, influencers who were using the masks, washing their hands, keeping the distance. And the very same figures were also thanking then the public of still washing their hands and still using the mask and keeping the distance. Next. And besides what we have been running this system last month, we also expanded it. So we actually carried out a series of workshops for 7 partner organizations with the aim for giving them skills and the knowledge to create their own social listening system based on their own context and their organizational structure they have. So we had 4 2-hour workshops that covered how to create a structure, the analysis part, and then how to use the analysis in actual risk communication. Next. And this is an example that came out of the workshop. The city of Vantaa, the epidemiological unit, made a plan for listening through their field staff, members of different minority language groups. So they have field staff working with Arab speakers, Russian speakers, Estonian speakers, and those people were tasked to record their conversations and discussions while they're working with these target groups into a joint Teams platform. So kind of coding as you go, simple thing. And once a month, the working group was planning to get together, review the coding and their observations, and come up with their analysis and recommendations that are then delivered to risk communication colleagues that can develop messages and contents. And once the content is created, it goes back to those field staff members who can then deliver the messaging back to their target audiences. Next. So what we have learned now during the last year and so is that definitely this is a useful tool when you want to have risk communication content development. So basically anything that we have been delivering out has been has been benefited, or this system has benefited the communication. We also learned that we can also see early alerts of misinformation and disinformation. This has happened many times, that we have picked these signs of potential misinformation very early. And we also notice that it works very well reaching a vulnerable population. So it's really, for the targeted communication, an excellent tool. We also know that there is no one size does fit all system. Like, this kind of system has to be developed and adapted to the context of the organization or entity, based on their structure and the human resources and all that. What has been challenging and keeps still challenging is this knowledge co-creation, to get people together and have really and spend some time to think about it all, which is very much needed as a part of the qualitative inquiry, just because people are overly busy. So we continuously try to find other ways and make it more flexible and easy, so that more people can join these knowledge co-creation discussions. And monitoring and evaluation is still something that has to be integrated into our plan. We are still getting to know how the system is used really on ad hoc basis only. Yes, thank you.